Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you very far.
Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. This video today is dedicated to those who live in the Villages, Florida. So over the past couple of days, we've been looking at a lot of information that has to do with the Villages. Many New York City retirees happen to live in this area, and after a meeting that Bob and I were both at this week, we became seriously concerned over the information that we found out. So there were several people that insisted with us that the Villages Healthcare was not going to accept Medicare Advantage any longer. I'm sorry, traditional Medicare any longer. And we were like, we had never heard that. And you've always heard me say that typically doctors and 99% of doctors and hospitals will accept traditional Medicare. It was one of the greatest civil rights achievements ever. If the doctors and the hospitals wanted federal reimbursement, then they had to accept traditional Medicare. So I announced yesterday on our Friday Night Live, we now had to add that the Villages will no longer accept traditional Medicare. Now, why is this unusual? And this is very concerning. This has the ability, unfortunately, to affect a lot of things that are happening. You have always heard us educate you as to why Medicare Advantage is bad. We have always told you that when you are on traditional Medicare with a supplement, like your city supplement, for example, if you go to the doctor, then the doctor sends the bill to Medicare. If you don't go to the doctor, there are no bills. In Medicare Advantage, Medicare Advantage is privatized, for-profit alternative to Medicare. This is where an Aetna, a Humana, a United Healthcare, an Anthem, they will go to Medicare and say, I want to run a policy called Medicare Advantage for the Villages or for city workers or for Exxon people or whatever. And then they create a plan. But because the government is so inundated with like over 3,000 of these plans, plus dealing with all of Americans that are on Medicare, they don't really have great oversight. And by the time they get to looking at something, if there is a complaint, it could be years down the road. But Medicare says to these companies, okay, no problem. We're going to give you a capitated rate, which is like a ballpark rate. Let's say $1,500 a month a person for you to administer Medicare to any resident in the Villages or any resident on Exxon or any resident, any person, any retiree from MTA or in the city of New York. And if you don't spend that $1,500 a month, you get to keep it. And we also have a procedure known as upcoding, that if you happen to go to Marianne's house and you find that Marianne has all these other issues healthcare-wise that will create a greater risk for you, you can code those and we'll pay you more money. So we've also told you about upcoding for years, where many of these companies who have been accused of upcoding or Medicare fraud under the False Claims Act, where you wrongly overcharge the government. It's called a key tam case. This is Medicare fraud. And the Department of Justice and the Office of the Inspector General get involved in these cases. So when we heard this the other day, I quickly went to their website as they led me to it. It's called the Villages Health Systems. I went there. And as I'm scrolling through the page, all of a sudden, I said this yesterday, I started getting like the hair on the back of my neck was standing up. Red flags everywhere. At the bottom of the page was a button to click for all brokers with Medicare Advantage plans. I'm like, why would a health system, doctors, serving a community of 55,000 55 and over adults, have a button to encourage Medicare Advantage brokers. And then all I'm seeing list after list is Medicare Advantage, Medicare Advantage, Medicare Advantage. So it ends up that all of the research we did in the last several days, that the Village's health system is in bankruptcy. And this is because they decided to create a model that was running basically on Medicare Advantage. What they thought they could do was enrich themselves by these capitated rates and leverage them to the care that they were providing to 55 and over people in the community. However, they then got caught as the insurance companies started to recognize that the Village's health system was coding improperly, and according to records by the Department of Justice, potentially owes the federal government $360 million. Now, that case is not yet finished. They're still in the middle of investigating it, and it is not done. However, because it is the Village's health system, and they were in bankruptcy court, they then had to put their assets up for sale, and in hopes to try to keep the Villages going forward, they then made a deal with CenterWell, which is run by Humana, no longer United or any of the others that they had partnered with, is run by Humana to take over the Village's health system. They are now, once again, going forward, building their healthcare program strictly around Medicare Advantage. Again, they want the capitated rates. What they told me 2 days ago when I called the Village's Health is that if you are a current patient, you must be a current patient in the Village's Health. If you have a original Medicare, traditional Medicare with a supplemental plan, that is the only way you will be able to continue to see the Village's health providers. If you are a new patient to the Village's Health, they will not accept your health insurance if you have traditional Medicare. They will only accept Medicare Advantage. Does that mean you should jump to Medicare Advantage? Hell no. And I would also not use a Village's Health provider either. One of the things we started looking into was the CEO of the Village's Health, which is Bobby Trin. Bob Trin is the CEO of this plan. If you look through the Village's news, you will see that there's a lot of things that are being alleged against him, including taking money out of this company the day before it declared its bankruptcy. He previously worked for Oak Health, and Oak was bought by Aetna Medicare Advantage to create primary health locations. Also, just so you know, Oak Health was also found guilty by the Department of Justice for False Claims Act things that they did in overcharging the government, and had a settlement well over $60 million. Prior to that, he worked for a group called, let me see if I can quickly pull that one up. I think it was like Physicians United. And guess what? They became insolvent. So unfortunately, I'm going to make this assessment to you. If you are a retiree living in the Villages area and you are on traditional Medicare, please find providers that are outside of the Village's Health. If you are a under 65 retiree, you would be moving on to the new NYCE PPO plan, which utilizes the United Healthcare Network. Well, one of the history points to this issue with the Villages is, I think it was back in 2016, they tried to force all retirees that lived in the community that were Medicare eligible to go on to a single Medicare Advantage plan sponsored by United Healthcare. If you look at the list of creditors in this bankruptcy today, not only does it include Anthem and Florida Blue, it also includes United Healthcare. And since the Village's Health is now moving to CenterWell, which is owned by Humana, it will most likely not renew the contract with United Healthcare that expires December 31st. I would be completely shocked if they did, but we will not know now until the end of December. So if you are a Florida retiree living in the Villages, we are urging you to find other physicians if you are on the Villages Health and seeing a physician in the Villages Health and you are on traditional Medicare. We do not recommend that you go onto a Medicare Advantage plan strictly just to see the Villages Health. If you are pre-65 and you are moving to the NYC EPPO plan, it is really important that you pay attention to whether or not they renew that United Healthcare contract. And that contract doesn't expire to December 31. Why? Because their website already says that unless that contract is renewed, they will no longer be taking any United Healthcare plan. So unfortunately, this is what happens when you move into one of these master planned communities. And I'm going to tell you something else. This is part of Medicare fraud. And that this business model is strictly going around leveraging your Medicare benefit to enrich their company. Right now, they are majorly in the hole. They owe the federal government $360 million. The investigation isn't yet completed. The gentleman that's running it, Bob Trin, has now been at 3 different companies that one is insolvent and 2 were already have False Claims Act allegations against them. And yet he is now the CEO of the Villages Health. Do not put yourself in this. If it's at all possible, please try to find yourself providers if you're on traditional Medicare outside of this system. For those that are on United, I just can't tell you, it's a wait and see. And this is why we keep saying that this privatizing your health is a problem. Here is a business model that is built on leveraging your Medicare. They're literally built themselves on the fact that the federal government will give them access to your Medicare dollars, paying them $1,500, $2,000 a month, whether or not they keep that money to use for you or they keep it for profit. The goal is that they're supposed to make you healthier and spend more time with you. They even played it off as they wanted to be the Marcus Welby medical centers of the Villages, where the good people, we care about you. We want to spend time with you. But they are limiting and controlling your care and forcing you into primary care. You don't have the freedom in this model to go to any specialist that you want to. You must go through, like it was an HMO, with a PCP that will then allow you to go where they think you need to go. And remember again, because they are now in control of your Medicare, if they want to limit your access to care to maximize their profits, they can, because you literally allowed them to control your Medicare. Medicare Advantage plans cost the government over $80 billion in excess versus traditional Medicare fee for service. You go to the doctor bills Medicare. If you don't go to the doctor, there are no costs. And if you go to the doctor and he says you need a test or a procedure, you get it. So unfortunately, I'm leaving this short and sweet because this has to track. People have to watch this. They have to understand that if they are currently living in the Villages, Florida, this is a real concern. People thought it was just that they had to change out of their traditional Medicare to see their doctors. No, I wouldn't even get involved with the Villages health system. Now knowing its background, the CEO has been previously 2 failed physical institutions where there were False Claims Act allegations by the DOJ and the OIG. And he's also connected to venture capitalists. Venture capitalists come in, private equity comes in, they buy up these businesses, they buy up medical practices, they buy up veterinary practices, they buy up businesses that they think that they can suck out all of the profit out of, and what typically happens is they end up going out of business. You now see that this is another business model like that. So I just wanted to interrupt your Saturday evening to tell you this. Please enjoy your weekend. If you don't live in Florida, if you do, you've got a little bit of homework to do. You need to find yourselves providers that are outside of the Villages health system. Have a great night, everyone. And remember, there is nothing like traditional Medicare and a supplement. Medicare Advantage is not Medicare, and it's not an advantage. Have a great night, everybody. Ciao.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make.